You may have heard of redirection, but what actually is it? Redirection is here to make sure you receive the best, most appropriate treatment. Staff in this department are trained to deal with patients experiencing an emergency, for example, a heart attack, a stroke, a major injury, a broken bone, or other such injuries. Sometimes, we find that people who come into the emergency department have a problem that would be better dealt with by a service with more appropriate skills and treatment options. Being seen by the correct person means that you'll receive the best advice and the most appropriate treatment first time round. This may be your GP, a pharmacist, an optician, a dentist, or other health professional. The other reason for redirection is to make sure our staff are free to treat people with emergencies as quickly as possible. When we see patients with non-urgent conditions or with conditions that we cannot treat, we are taking time away from those with more serious problems. This can delay the treatment that they need. We therefore need to make sure those with an emergency problem are seen as quickly as possible, and those who benefit from redirection are correctly identified and given appropriate advice. The decision regarding redirection is taken by a senior doctor or senior nurse. If the potential for redirection is identified by the first nurse you see in the triage room, you'll be asked to wait for a discussion with one of the senior members of staff. They will have a conversation with you about the reason you have come to the department. This will help them to judge the urgency of your medical problem. If we are the best service for your needs, then we will ask you to wait to be seen. You will not lose your place in the queue. You will not be put to the back of the queue. If through discussion it is felt that your problem would be better dealt with by someone else, then you will be advised to make alternative arrangements that better suit your medical issue. We appreciate that you might be frustrated if you are advised to see someone else, having waited in the department. However, we see redirection as something that helps to ensure you receive the most appropriate care for your needs. If we advise you to see another professional, it is because we feel that this is in your best interests. We do our best to have our conversation with you as soon as possible to minimise this wait, but this depends on how busy the department is. If you would prefer not to wait, please inform a nurse or member of the reception staff. Should you wish to be seen by an alternative healthcare professional, please contact your own GP or call 111 NHS 24 to arrange an out-of-hours GP appointment. If you have any questions, please don't hesitate to ask a member of staff.